This is the 5th time he's had this treatment, but for 5-year-old Googie, it's old hat. As the micro-catheters are attached to his skull, he's chatting away happily. But the technique his doctors are using is groundbreaking to try and overcome problems of getting cancer drugs into the brain.
There's a natural barrier from the bloodstream into the brain which blocks poisons, which is useful for us, but also blocks the chemotherapy getting in to treat the tumour. So over a number of years, my team, in conjunction with a company called Renishaw, have developed a system of tiny tubes which we can use to drive drugs directly into the brain and to get this chemotherapy right into the target.
This home video was shot shortly after he was diagnosed last year, having almost overnight begun to have problems with speech, vision and walking. The issue is that research funding goes to the more prevalent types of cancer, whereas Googie's brain stem tumour is comparatively rare. So fundraisers want to raise nearly £1 million for clinical trials through crowdfunding.
Well, it takes quite a long time to get grant funding, and because the nature of the condition of a DIPG tumour means that it really is a race against the clock to try and get this trial started. So to go through all the traditional processes is, obviously if we had to do that we would, but we really want to try and get this moving as quickly as possible.
The 4 previous doses of chemo have helped Googie. The tumour is smaller, his vision's improved, and he can now walk unaided. His father is delighted, but understandably still uncertain about his future.
I saw the results. There are huge results, because the amount of the reduction is incredibly high, and I hope it's sufficient. It's enough to destroy the tumour.
Most children with a tumour like Googie's die within 9 months, but it's now 14 months since his diagnosis, and with the new technique, he has a fighting chance. Nick Ravenscroft, Sky News.